Okay, welcome to the Killer Psychologist. We have Rox the Doc here with us today, Dr. Roxana Eubanks. She is a clinical psychologist and she has experience working in corrections, but interestingly enough, she's transitioned to her own private practice where she helps high performance athletes with stress and specifically equestrian professionals. And I'm so curious about your journey, how you got started so young, and tell me a little bit more about your specialty. I'm fascinated with it because I went on your website and I noticed that you have this very specific boutique services that helps these high performance athletes. And it sounds like you really customize services for them. So I would love to hear your journey and what made you decide to become a psychologist?
Well, first of all, thank you so much for having me on. And I guess to start off, I've always been really fascinated and interested in the intersection between psychology and high pressure or high stakes environments. On a personal note, my family, they fled communist Romania, and my grandfather was incarcerated as a result of that. And so just seeing the impact of the traumatic experiences, how to this day that has led to not just anxiety, but also physical health problems, is kind of where my interest in psychology started to build. And then early on in my career, I just loved really challenging environments. I started working in halfway houses, which really started just feeding into my desire to work in correctional settings. And then in my postdoctoral or my pre-doctoral training, I did my internship at the Federal Bureau of Prisons. And so here I worked with inmates, really just addressing their trauma, any substance use, as well as the impact incarceration has on individuals. And I saw firsthand how untreated trauma can impact not just individuals, but communities and societies. So that all kind of shaped my belief that therapy needs to be accessible to everyone. It needs to be flexible, as well as just to be tailored to the unique demands of an individual's lifestyle. And so through my experience in the corrections world, that's now why I started offering concierge services as part of my private practice. Here I apply kind of all those lessons I learned in the prison to high-performing athletes. These individuals tend to operate under extreme pressure, isolation, and scrutiny. And so I love just how flexible and moldable the model is for them.
Oh, I love that. Thank you so much for sharing. Yes, I agree that therapy needs to be accessible. And I noticed that you can bring therapy to someone wherever they're at, going to their location. Tell me how that works out. And since we're kind of going to talk about boundaries today, how do you enforce your boundaries that it's a professional relationship when you meet them on site?
It starts right from the beginning of my first conversation with the individual, right? When I'm kind of just screening them, seeing what services they're interested in, as well as the informed consent process, right? And so informed consent is not something that's just kind of a one and done thing. It's something that, of course, we get from the client at the intake, at the onset of services, but as well as throughout the process, the therapeutic relationship. And so, those boundaries are really in my intake paperwork and the contracts I have with these individuals, where we lay out, what does the structure of therapy look like, session lengths, communication outside of the session, how all of that transforms. And with concierge services specifically, it's interesting because I can also meet them, right? Whether it be at their training facility, at a competition. And so it's not just in a traditional therapy office. And so all of those dynamics are really clearly laid out in my intake paperwork, as well as just the boundaries that I am placing and continually shaping with that individual from our first conversation.
I love clear and explicit boundaries at the onset of therapy or any relationship. even a dating relationship or just any relationship. I feel like I'm the queen of boundaries, so I make it really clear. I mean, right at the beginning, just so we know the nature of this relationship and what to expect from it. And so it's so critical. And, you know, as a psychologist too, I think that's such an important component. So going over the consent, going over the agreement, and sometimes I'll have the client say, repeat back to me what your understanding is of our relationship. And so the clients I deal with can be a little different, but they can actually be incarcerated or in a hospital or have limits to their capacity or understanding. So I try to make sure that they understand what to expect going forward. Or if they've had a different relationship with their therapist in the past that wasn't healthy, or they behaved poorly, or there was some problem, I like reiterate what will not be happening or what will be happening moving forward, or how things will be documented, whether we're going to record the sessions and like just so professional, because I do record sessions or offer that. And it's so, and we can consent to that. So at any point you say, this didn't happen or this happened, it's not like everything's just above board. And even, summaries of our meeting afterwards are sent to them. So it's just, I think boundaries are so critical, especially in people are coming to you with a need. They may be in an emotional deficit. They're seeking help. And so or they're having conflict in a relationship or some dynamic. So you want to set the example of having good boundaries, because you want to show them how to do that in their other relationships in their life.
Certainly. And even going off of what you said, in my intake paperwork, I even have a section where I list, these are what ethical behaviors look like. This is what the therapeutic relationship entails. And if at any point you're concerned that boundaries have been crossed or unethical behavior is taking place, this is where you go to report it. Right. And so, like you said, right from the beginning, we're very explicit in what these boundaries look like, as well as in vivo in that moment when something comes up, we're role models to them about what an appropriate dynamic looks like, and how they can take that, not just in their relationship with you, but their relationship with others moving forward.
Yes, exactly. I love it. And telling them who governs me. If I do any bad behavior, I'm governed by the Board of Psychology, and I'll state how they can find, I'm in California or licensed in Nevada. You can look at the board and you should verify if your therapist, psychologist, medical doctor, whoever you're seeing, I don't care, your dentist, that they have an active and valid license. We've all read the horror stories. We're going to highlight some today, but you should. You most definitely should look. If you are going to invest time spent with me, definitely look at my website, verify my license. And what I found sometimes is like, oh, wow, this person is on probation. Or wait, they're suspended with the board. Like, what is going on here? And sometimes you can find out a lot of information there. And I will mention recently I was involved in a case, and it's a legal case, but on the other side, they'd hired a psychologist, and we're seeing this person for, over a year. But the first thing I do is just verify they have a valid license. It's really simple. And he did, but he had also was convicted of fraud. For billing patients when there was no sessions. And it was like in the sum of like $45,000. And it went on for like a period of time. So I actually read the information. It wasn't just like a mistake. It was a pattern of behavior that happened over many years. And he stole money. And so I brought that to the attorney's attention because, they hired the wrong person, in my opinion. It didn't help their case, in fact. Okay. So I just really empower people to know who you're hiring and look at their background, right? You should be informed.
Yes. Yes, definitely don't take things just at face value. Do your research, do your homework. I think for other services, we as individuals, we do so much research, so much homework about the person that's going to be giving us these services. And it's even more important when it comes to medical professionals or clinicians that we're seeing. And I love how the internet has made all of that so accessible just at your fingertips. And you can even see if that clinician has ever had a complaint filed against them. So we just have so much more information now at our disposal. And I think that's great.
Interestingly enough, I was on LinkedIn this morning because I was just checking things out, and I just happened to come across a medical professional who was a licensed doctor, and he was sharing how he had got in trouble with the board for having a sexual relationship with the client, and he was explaining the relationship and that people should forgive him, or he's moved on, or he can still practice now, or like his discussion. I ended up going to try to log back on to find out more about the case, and then I lost who it was, but I was so curious. So I thought it was interesting. So this is a person now, after they've been found out or they're on probation or there's some problem, they want to go back to the social media and try to explain their behavior and try to build trust back. And for me personally, so I'm not interested, and I wouldn't hire him. There's plenty of other clinicians out there. I will just choose someone else. So.
Mm-hmm. Oh, yes. And I think the justification is so interesting to think about. And that's something that comes up a lot when you look at, or when you read about therapists that have engaged in sexual relationships with their clients, the way that they can justify it to themselves. And so one way they often justify is, oh, I'm helping my client, right? Whether that be I'm helping them work through something, a relationship dynamic that's problematic, or as well as, this is just what this person needs, as human being. I've also heard where it's, we're both adults. We're both able to consent to this, when really the therapeutic model itself, it's a one-sided relationship. It's imbalanced in and of itself. The client is usually coming to you in a vulnerable state. And you, as the clinician, you have expertise, you have credibility, and you're in a position of power against this individual. And so when I hear clinicians or the medical professional that you brought up try to justify it and say, oh, I've learned from my mistake, I've moved on, I think you should rehire me. I think that's incredibly harmful, and not just unethical, in some cases illegal, which we might talk about later today as well.
Okay, you said justification and rationale, so I'm going here with this one. I was reading this article this morning, and honestly, my jaw dropped. It's the rationalization for some of these behaviors. So there's a Dr. Ali Sahebi, not sure if I'm saying his name right, but he was a Sydney-based psychologist, very popular, had like 500,000 people following him, did TED Talks, was married with kids, and he got in a relationship with a client and they were having sex. So in the article, he started having group therapy in his home. So if you want to talk about red flags. And then after that, introducing like whiskey. So that's what led to sex in his home with the client. And he eventually told her, we're doing this because, I like you. I love you so much. I want you to be my partner. So his final defense in the end, and look, it was pretty incriminating. Okay. He sent texts like saying, I will lick you all over. Okay. And this is his defense. Like, I can't make this up. Okay. He said in his defense, that's how I show I care. And what I meant was, that's like how a cow licks her calf. And then he put other texts like, you have this, I admire your body. He's like, I was just saying you are an energetic and healthy person and like have an athletic body, or it's a metaphor. It's like, talk about gaslighting your client. I'm sorry, you went to him for therapy and he like gaslights you into, how harmful is this for people? You go to a professional for help. Mm-hmm. What if I had problems with drinking and sex and now you're in this person's home? Like, such manipulation and this justification, it's just out of control.
It really is. And the ramification of this can be severe, right? Ranging from individual now developing PTSD, as well as just mistrust in medical professionals and clinicians in the mental health field itself. And it's crazy to me, how when we look at statistics, right, the numbers kind of vary. Some of the research I've looked at, they kind of tend to say about 3% of psychologists engage in sexual relationships with their clients, right? And even 1 in 50 is crazy, right? Completely unacceptable. And so the fact that this is happening over and over again, and these harmful individuals continue to justify their actions as being helpful, when, like you said, our clients come to us for help, right? This is supposed to be an environment where healing takes place, where self-discovery, where growth. And so now for us to have then become the perpetrators of this violence, of this trauma, it's just disgusting.
I'm going to be honest. It's the hardest thing professionally I've had to deal with in my career, period. And I deal with intense, violent criminals, from rape to murder to everything, from, all the most horrific cases you can think of across settings. So I deal with that. My horror in my career is encountering professionals who manipulate, extort, and these relationships and cross these professional boundaries, end up having inappropriate relationships. It's caused me absolute psychological distress by observing colleagues do that, because it's so upsetting to me. It's so horrifying for our profession. And it's very traumatizing for the individuals going through that. So I'm working with severe mental illness, and then to have your client that you're helping, or somebody, your colleague, do something like that. And I've experienced it in every setting I've worked, by the way. And just like these cases I'm talking about, actually other professionals having sex with severely mentally ill patients, like who are hospitalized or incarcerated. I just don't have any tolerance for it. There's no excuse. There's never a time. So my reason for having such strict boundaries upon the onset of any conversation is that I'm leading this healthy example of, most of these people have been abused physically or sexually or things to that nature. So they've been groomed, or they're grooming others, or they're trying to violate your boundaries. So right at the onset, like, I want them to know what a healthy relationship can look like. And so that they learn and understand that. And I tell them so they won't be a victim in the future, because you're not going to get yourself. These are the warning signs. These are the red flags. No one should do this to you, ever. This is how I'm teaching boundaries. Like, I would teach boundary classes for patients so that they could learn how they would not be victimized. Like, they can empower themselves. I just can think of so many stories in my head of other professionals crossing these lines, and it's been absolutely devastating to watch happen.
Mm-hmm. I couldn't agree more. And I think even when we go back to the beginning of our training in our doctoral programs, a lot of it is meant to kind of weed out these behaviors, right? To teach us how to be ethical clinicians. And despite that, though, even when we're graduated, even when we're licensed, we all have a personal responsibility to continue getting supervision when needed, consulting with other professionals, ethical professionals, I should specify, as well as just having that accountability aspect. Because if we're not holding ourselves accountable, and if other professionals around us are not holding ourselves accountable, it can be really easy to start, kind of getting in these ethical gray areas, where these things can happen.
Yeah. So let's talk about boundaries. I'll just mention emotional boundaries for people to think about. So if you're a professional, you never want to be in an emotional deficit when you show up to work expecting other people to meet your emotional needs. That's not my role as a psychologist. Like, that's a dangerous narrative. You're expecting that your clients to, you're expecting compliments or feedback, like adoration and praise, or like, no, you should not be expecting any of that. You have a specific job to do. And to be honest, in this profession, of course, if you worked in corrections, you may not, that's a dangerous narrative for you to even be accepting any praise, or that those are red flags right away. And you don't want to be allowing those comments or feedback. You need to nip it in the bud real quick. If someone's flattery or anything, come on. Like, in the correctionals, you'll have to tell me your experience working in a federal prison.
Oh my gosh. I mean, it was such a new experience for me. I kind of was a deer in the headlights, in the beginning, because even though I've always had boundaries, not just in my personal life, but my professional life, like you said, when you're in the correction world, your boundaries are very black and white. They're very concrete. There is no flexibility there. And so I remember one time, because, inmates, not all of them, but some of them, I think human beings in general, right? We're very inquisitive. We test individuals, try to see, okay, how far can I get with this individual? And so they'll do things all the time to test you. And I was working once with a sex offender. And, he gave me some kind of compliment, and he gave me a high five, right? And so we were in like their living area, and there were a lot of inmates walking around. And for a second, I had this kind of like out of body experience, like, okay, this individual just raised their hand to high five me. If I was in private practice, maybe I would high five them, right? If it fit or it was suitable for that interaction. But then I had to keep in mind, okay, this is the setting I'm in, and what is me high-fiving this individual going to communicate, not just to them, but the other people around them that are watching this interaction take place. So I had to very much be aware of my body language, not just verbally what I said, but my body language, and keep all of that in check at all times. So I learned to kind of not be cold, but just be very blunt. To be professional, to be courteous and respectful, but to have boundaries that were really solid, because you needed to survive in that area.
Yeah, and grooming starts with that initial introduction of physical touch or contact, even if it's harmless at first, but that's where it starts. So it's a no contact for me. I worked in correction, so there is no contact. So look, I worked in the psych hospital for years, and I never hugged patients. And I'm telling you, my colleagues hugged their patients, and they disagreed with me. Some of the nurses or other medical professionals. It was 100% no for me 100% of the time. And I will continue to set that boundary. it wasn't that, look, I know, look, my mom works in hospice, so maybe that's different, but like, it's just, I can't do it. And it's just dangerous. And it actually did create problems. And I disagree with it because it caused problems with how patients saw certain people getting hugs, or there was like a disparity, or like females can hug female staff. Like, where does it end? And it actually caused problems. It caused physical violence. It caused, I think what I would have to ask professionals is like, why do you need a hug?
Yeah.
Why would you need a hug from your workplace? Like, you shouldn't. And honestly, there were some middle-aged women I worked with who wanted that type of connection. It's like, yeah, get it from someplace else. Like, don't come to work. And they did. I have really strict boundaries, and it's by design so that there's never any miscommunication on where I stand.
Mm-hmm. No, and I applaud that. And I think it, like you said, it can really start to become an ethical gray area, and it could lead to a dual relationship, right? Where not even just sexually, but maybe your client is now thinking that you're friends, right? You're showing favoritism. You're going to make exceptions for them. And all of that can contribute to unethical behavior. And so we, as clinicians, we always have to be mindful of this, because we can start to lose objectivity, whether that is lack of quality training, a lack of supervision and consultation, as well as, like you said, maybe personal vulnerabilities. You're having issues at home, right, that you're not working on. You're not in your own therapy if it's needed. And so we really need to be mindful of these things, to take care of our side of the yard or our side of the fence first, so then we can show up as competent and ethical clinicians.
Yeah, 100% agree. And there's some scary cases that I was reviewing online where therapists have crossed the boundary, and it's so dangerous. And the case we're going to talk about, you're dealing with unstable people many times they're dealing with chronic suicidality, homicidal thoughts. They have a number of issues. They've been psychiatrically hospitalized, or they have, serious felony convictions. So they are dangerous. So you need to be careful, and it could cost your life. And so there are cases where it's like, in the end, that clinician is now filing for a restraining order, and this client has become obsessed with them. But so what happened to bring it? How did we get here? Right.
And I think sometimes it's a gradual process, right? I think a lot of times we think that, oh, maybe this was just a isolated event, right? Where it led to this atrocious behavior, unethical, illegal behavior. But really, it's like we talked about earlier. It's the slow decaying of boundaries. It's, engaging in excessive self-disclosure with your client when it's not suitable or helpful for them. And encouraging your client to be dependent on you versus independent. And especially when you have cases, or like you said, right, where this individual has extreme trauma, they've been hospitalized several times, suicidality is part of their history. We really want to be extra cautious to teach them healthy coping mechanisms so they're independent and that they don't need us anymore, right? We want to work ourselves out of a job.
Exactly. So I don't do a lot of therapy, but when I do, it's very clear, it's very time limited, and it's measurable with progress and notes and documentation. And like, I'll do the testing before. We have all the bar graphs on where their symptoms are. We do it at the end. And then like, if you need more help, we can refer out. So it's not like this forever relationship. And so one of the things I've seen lately, I'm going to say this, I deal with legal cases. So I'm scrutinizing professionals' records, and I'm seeing some very alarming things that look like fraud to me. So what are you doing for 2 years in therapy saying the person has no disorder? Like, that's happening in a current case right now. I have questions. I said, no, this person cannot go to that psychologist anymore. I have no idea what they're doing. Plus, they're doing, well, we know in fact they're doing nothing. Like, now you're called to testify in court. I need you to explain that to me. It's so dangerous. Don't have those therapists. It in fact will run your civil case or your child custody case or your case where you've hired this person. And then I'm going to get the records and go, so it's not helpful at all. And it's a giant waste of money. And then it turns out a lot of times it is fraud. So I like to build relationships with other therapists so I can know who to trust and who to refer to. And then, so I'll do like legal cases and I'll refer someone out and say I do quarterly reports to the court for mental health diversion. I'm looking at what is happening in therapy and like, what are the improvements, right? For risks. And I'm like looking for it. And I want receipts. So,
yes, objective receipts, screenshots, right? It's so important to have that objective data for ourselves. And that's also part of being an ethical clinician, a competent clinician in my book. And when we talk about these psychologists or clinicians that engage in unethical behavior, whether it be sexual relationships, whether it be financial abuse, fraud, things of that nature, we don't see a lot of objective data, right? It's all very subjective. That's where these boundaries start getting crossed. It's more like a friendship or romantic partnership versus being science.
Yeah. And I wanted to share a couple of clips about this case.
It's not uncommon for a patient to start to confuse that emotional intimacy with something akin to love.
I told some friends at church that I said I'm in love with my therapist, and I said I can't stop thinking about her. I'm having sexual dreams about her.
Kristin Marchese, she was a therapist who ended up getting emotionally involved with her client. And so it's just sort of, like you said, over time, there's, maybe a connection where the client thinks there's some, this emotional connection, or it's becoming intimate, or they're sharing all this stuff. And for them, the client feels that they're maybe seeing the relationship differently. And in this particular case, the client, Mark Huckeby, he, confessed his love to his therapist. And so he felt that there was a relationship. And so they ended up, he was no longer able to see her, but over like 6 months, that client was sent back to her where she continued to see him again. And there wasn't good boundaries. They in fact, it started progressing from sexual banter on social media through Facebook app to eventually a full-fledged affair where they were having sex during their entire hour sessions at the facility. And so we can play that clip here.
At first, they traded sexually explicit messages on Facebook, then started hooking up at local hotels. Before long, they were throwing caution to the wind.
I would go to therapy with her at Oakwood, and we would have sex in her office for the entire hour.
But in the end, it's so dangerous for so many reasons. But this person, in the end, that relationship meant something very different for him, because he in fact said he was diagnosed with bipolar, had PTSD, had a number of issues in prior relationships, and he was dealing with thoughts of self-harm and harm to others, and I wanted to harm her. So then all this builds up where he now wants to kill her. And now she's crying and she's getting a restraining order. This is going to court. She ends up resigning, turning over her license, but she ended up getting 3 years supervised probation, 6 months of jail, relinquishing her license. But like the damage to the client, and you can listen to him in his clip. He says how he wants to kill himself and her together.
How do you feel about it today?
Do you want me to be honest with you?
Yeah. please.
I want to kill her today.
His tone was matter of fact, but his intent was clear.
I want to kill her and then kill myself, like a love suicide, like a Romeo and Juliet.
2 days earlier, Marchese had filed for a restraining order.
It's her fault. She did this to him.
Now I'm in Winnebago because I don't trust myself, because if I get let out, I will kill her. I will kill her, and then I will kill myself, and we will both go to God and sort this out.
And I don't think you understand how much you've harmed him.
Judge Chad Kirkman sentenced Marchese to 3 years of supervised probation, including 6 months in the Kenosha County Jail. But the indiscretion is one that will follow her for the rest of her life.
She's damaged not just him, but she's damaged the mental health profession.
But at least her life isn't boring anymore.
And that is just a reminder for anyone to have boundaries. I deal with clients like that are homicidal, and I demonstrate very clear boundaries to actually help them work and navigate through those feelings. But like the long-term effect for this person, have to trust a professional.
That's heartbreaking. It really is. Because like you said, when we talk about this subject, we focus a lot on ethical consequences, legal potentially, but truly the cost, the highest cost is paid by the client, right? Where now this individual has experienced even more trauma, and who knows if they'll be able to repair, right? Or they'll be able to trust individuals again, providers, to have healthy relationships with their family members, their friends. You know, like you said, the consequences of this are just so severe. And we all need to be really mindful of that when it comes to being ethical providers.
Well, thank you for being how you are. Ethical, clear boundaries. I would love to refer clients to you. And I love your website. I love the services you're offering. I might steal some ideas from you too for concierge services. I think that's great. I think we need that.
Definitely. No, it's my pleasure. And I love talking to you and discussing these things because, like we said, so our profession, we have ethical guidelines, and a lot of them are pretty black and white, but depending on maybe the setting you're working in, sometimes we can be a little bit flexible with maybe our own personal boundaries. But I think it's great when, even though you're doing forensic work, and I'm now in the private sector, we're still on the same page. We're holding each other accountable, as well as hopefully educating other clinicians on what they need to do and the importance of accountability.
Yeah. And I also want to mention the Board of Psychology hires me, or other professional boards hire me to do evals on these situations where the professional is in legal trouble, and I do their psych eval. And so I would just encourage anyone out there that's listening, see someone before it comes court ordered or your license is revoked or suspended. We all have a duty to do no harm, and you have to maintain your mental health every day. So if at any point, any mental health professional, not just mental health, just any professional that is licensed, make sure you take the time to invest in yourself, see someone, and get a psychological evaluation. My opinion is they should be mandatory for, if you're a licensed doctor, psychologist, you should be mentally fit. You should be cleared psychologically. That's my opinion on that. And I think some people aren't. And I would say anyone, if you're going to go into this profession, just make sure that you are fit. You are mentally fit yourself before you try to go help anyone else. Take a look inside.
Definitely. Right. Just like when we're on an airplane, they tell you in case of emergency, you put your mask on first, the breathing or the oxygen first, and then you help the individuals around you. We need to take care of ourselves first. So we reduce the likelihood of us engaging in any of these problematic behaviors.
So It was wonderful chatting with you today. Where can people find you if they want to hire you? I feel like I want to hire you as my therapist also.
Oh, you're so sweet. It was my pleasure. But for those of you who are interested in my services or even consultation, you can find me at roxthedoc.com, as well as on Instagram and TikTok at Rox the Doc. So thank you so much for having me. This was truly an honor.
Thank you, Rox. It was wonderful. Thank you so much. Thanks for listening. For episode details and merch, check out killerpsychologistpodcast.com. And for forensic services, you can book online at psychology.dr.